It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events. And get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone. I'm Julie from Morton Hospital, and we are happy to welcome you to our radio show today, and we thank you for listening. Today, we are very happy to be bringing you a new episode of Morton in the Morning, and we have a great topic. Today, we will be speaking about the importance of sleep for good health and how to get better sleep. So hopefully that is a topic that many of you out there are interested in. It's definitely one that I am very interested in. So we will be interviewing a special guest later in the show. But first, I wanted to share with you a few exciting announcements from all of us at Morton Hospital. The first is that Morton Hospital has once again received an A hospital safety grade from the Leapfrog Group. So hospital safety grades, the Leapfrog Group is an agency that looks at several different patient safety standards, and twice a year they assign a letter grade, either an A, B, C, D, or F grade to all hospitals across the country. And we are once again happy to be receiving an A for safety, and that is our fourth consecutive grade A, and that just came out for the spring 2022 update. So we are very fortunate for that ranking, and we want to celebrate and thank our staff. It's really a testament to all their hard work and their dedication to providing the safest care to our patients, which has allowed us to receive this achievement once again. So congratulations to our entire staff on receiving our A for patient safety. We're also really excited that the Best of the Best Community Choice Awards are back up and running for 2022. So as you know, in the past we had spoken about the 2021 awards. For many years Morton Hospital was nominated, and last year we were so excited to take home the top award for Best Hospital for the 2021 awards. And we also won Best Audiologist, Best Hearing Aid Center, Best Physical Therapy, and Best Weight Loss Center. So that was really exciting. Our staff was so proud of those achievements for the 2021 awards, and 2022 is up and running. Right now, it is the nomination period. So this is being run by, the Taunton Gazette and the Enterprise News for the awards for the Metro South region. So if you go onto one of their websites, you click on contests, you'll see the Best of the Best contest. And right now, for these first couple of weeks, you can nominate your choices in each category. And then after that, there will be a voting period. So we want to kindly ask for you to nominate Morton Hospital so that we can recognize our team in the categories of, Best Hospital in the same categories as last year, Best Audiologist, Hearing Aid Center, Weight Loss Center, and Physical Therapy. And also our partners over at Health Express Urgent Care, they also won in 2021 for Best Urgent Care, and we would also encourage you to vote for them, Health Express with Morton Hospital, in the urgent care category. So please nominate us. You can write us in, just write in Morton Hospital in all of the various categories that you can nominate us for. Before we get into our interview, just a reminder about how you can contact us here at Morton in the Morning. We have an email address set up that we welcome you to reach out to at any time if you have any feedback, or if you have any questions about our show, or if you want to suggest any topics for future shows. You can email us at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. And we always love to hear from our listeners. Reach out with any questions or feedback at any time. We would love to hear from you. All right, so it's time to jump in today's show. So our guest for today's show is Melissa Brailsford, and Melissa is actually no stranger to the show. I believe she's been on once or twice already, maybe more. Welcome, Melissa.
Thank you for having me, Julie. Always fun to return.
Excellent. And I think we have a great topic to discuss today. Even though May is over, there were a bunch of healthcare observances and recognition weeks, days, months in May, and one of those was Better Sleep Month. So we really felt like that was a great topic that so many people can relate to. I myself am hoping to learn some tips today because, there's nothing better than getting a good night's sleep, because if you don't, it definitely throws off your whole day. So we're going to be talking about sleep habits, sleep disorders, and a little bit about our sleep center here at Morton Hospital. So tell us, just to start, about yourself. What's your official title and, your role here at Morton Hospital?
So my official title here at Morton is Manager of Respiratory Care, Sleep Medicine, and Cardiovascular Services. I've been here for almost 5 years now. I get to oversee a lot of the day-to-day operations, have patient interactions, so it's quite a bit of fun for me here.
Okay. So you oversee the sleep center, which, how long has it been since they moved across the street to the hospital? Has it been 2 years already?
So it's been a year and a half.
Okay.
We moved in December of 2020.
Okay.
So we'll come up on our 2-year anniversary this winter, which is exciting. Yeah.
So it's a beautiful suite over there. If everyone remembers, our sleep center used to be located down on Paramount Drive, and it was kind of a darker space, but now we are in the beautiful Liberty Medical Building, and it's brand new. The space was really built out for the sleep center, right?
Yep, it was customized just for us. So we have individual patient rooms. Each room has its own bathroom and shower, which our old sleep lab did not have individual showers. It only was in a handful of rooms. Mm-hmm. We have a bariatric room now, so we can accommodate anyone who needs bariatric surgery. We can also accommodate any patients who have disabilities, so we have a little bit more flexibility in the new lab with accommodations.
Mm-hmm. Yeah, and it's beautiful. I mean, that building, as soon as you step into the building, you can tell it's really nice. It's like, the marble floors, and it's just really, really nice inside, and it sounds like the new space is a lot more added convenience and also comfort for the patients. So,
absolutely.
So what exactly does the sleep center do?
So we get to diagnose and help people have a better night's sleep. So the sleep center, we help patients rule out if they have sleep disorders, such as obstructive sleep apnea or narcolepsy. Those are our two biggest types of disorders that we see. So we get to have patients come in during the day, and they can take home sleep studies, or they can come in overnight, and they have an overnight sleep study where they stay with us for about 8 hours, and then we have patients who come in overnight, and they stay overnight, and they sleep with us all day as well, and that's just to rule out different sleep disorders such as the narcolepsy. That's a big test. So our patients are with us for a while.
Okay, and the narcolepsy, that's when you sort of like fall asleep during the day or at any given moment?
Yep, at random, yeah. So,
and is that a disorder unto itself, or is that because of bad sleep that you're just so tired you just fall asleep all the time?
In and of itself, its own disorder.
Okay.
Yeah.
So if you're just joining us, we are sitting here with Melissa Brailsford of our leadership team here at Morton Hospital, and she oversees our Center for Sleep Medicine, or our sleep lab, how some people commonly refer to it, over across the street from the hospital. And today's topic is all about, getting good sleep and how sleep impacts your health. And we have a lot more questions for Melissa and a lot more discussion, and she's got some great tips for us later. But before we get into some more questions, we have to take our first break of today's show. So we're going to take a quick commercial break, and we will be back with more with Melissa Brailsford talking about sleep and how it impacts your health and how to get better sleep right after this short message.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Morton Hospital's nationally accredited Center for Weight Control has grown with the addition of Dr. Deepthi De Silva, our new Director of Medical Weight Loss Management. Our center now offers high-quality medical and surgical weight loss options close to home, with medical weight loss appointments now available in Taunton and Middleborough. To learn if you qualify for weight loss surgery or medical weight loss and to schedule a consultation, call our Center for Weight Control at 508-301-2434.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning and welcome back to today's Morton in the Morning show. If you're just joining us, our show today is all about sleep medicine. So we are sitting here with Melissa Brailsford, who oversees our Center for Sleep Medicine, or our sleep lab, which is now located across the street from the hospital. And we're talking about, well, before we took the break, we talked a little bit about Melissa's role here, and we also heard, a general overview of what the sleep lab does here at Morton Hospital. So tell me a bit about the sleep center team that you manage over there. So who is there and what does each person do?
Yep. So we're staffed pretty much all day. During the day, we have a team at the front desk who schedule appointments, obtain authorizations for the study, guide patients as to what they need to bring. We also have people there during the day to help you with your home sleep study. So they'll bring patients in, set them all up. Then we have specific people that do scoring, that interpret and prepare the study for the reading physicians, and then they also do the narcolepsy testing during the day. And then at night, we have a team of people who welcome our patients to the sleep lab to perform the in-lab testing or CPAP titration. So we have a whole different team that comes in at night to help us out as well.
Okay. And you also have providers who are a part of your team. So what is their role?
So their role is to read the sleep studies and diagnose the patients. They also provide guidance to the staff as to if something's happening in the middle of the night that we notice in your sleep pattern, they're available for us to call and have better guidance as to how we should move the test along, if we should change the test and give you CPAP during the middle of the night because your sleep apnea is so bad, or if you should come back for a different test. So they may not be in-house with us, but they're available to us at all times.
Mm-hmm. Okay, and who are those providers and what are their specialties?
So it's mainly Dr. Bahati.
Mm-hmm.
His specialty is pulmonology and sleep medicine, and he is amazing at both of those jobs.
Absolutely, and I think he's pretty well known in our community as well. He always wins one of our top doc awards every year. We always receive so much positive feedback about Dr. Bahati. He's just a really special person. So definitely a good support for that team.
Yes.
I know that the Sleep Center recently received an accreditation. So what was that all about?
So we are accredited by the American Academy of Sleep Medicine, and what that means is that this academy reviews all of our policies and procedures. They come out on site, they do a full inspection of the lab, so they look at every bathroom, every bedroom. They talk to our night techs, they talk to our day techs, they talk to management, they talk to senior leadership. They talk to Dr. Bahati, they talk to Dr. Bahati's physician assistant, Beth Mastria. So it was a very big accreditation where they came in, they spent several hours with us just reviewing everything and going over what it means to have an accreditation from the American Academy of Sleep Medicine, is that we are following all the up-to-date practices and guidelines that are put out to help improve patients' sleep and to get patients the best and optimal CPAP pressures, BiPAP pressures, and technology out there for them.
Okay. And how often do you have to have that review to remain accredited?
So we are reviewed every 5 years.
Okay, great. All right, so let's get down to, the most important topic is, why is sleep so important to your health?
So sleep is very important to your health. Just, it improves your overall overall well-being, your overall health. It allows your body to heal. So if you have an injury, sleeping is when your body is really healing itself. So having good sleep allows you to heal. If you have bad sleep or poor sleep habits over a long period of time, it can really start to affect your mental health. Can give you mental health problems. It can lead to depression and anxiety. It could also lead to injuries because you're so sleepy during the day. You may trip and fall. You may not be paying attention when you're driving because you're too busy, dozing off. Can lead to other health problems such as heart disease, high blood pressure, diabetes, stroke, and obesity. So getting a good night's sleep, at least 7 to 8 hours, is really important for your body to rest, for your body to heal, and just for your body to be healthy.
So is that still like the standard, recommended length of sleep? I know you always hear, on different shows or whatever, everybody's different, and some people might,
it truly
do
is
better with 4 hours of sleep versus.
And actually, as I was preparing for this interview today, I was online on the Sleep Academy's website, just looking up other tidbits. And they actually have a sleep calculator where you can put in your actual routine, and it can calculate what is best for you. So 7 to 8 hours is always ideal, but some days you may need 10. Some days you're okay on 4. It's not ever recommended, but consistency over a long period of time is really what is beneficial. So if you can get 7 consistent hours of good sleep.
Okay. So I want to do this calculator. How does one find this calculator?
So it's on the American Academy of Sleep Medicine's website. So it's aasm.org. And then I think there's education. You can go under that.
Okay.
But there are sleep calculators out there that you can go and see and pick your best night's sleep.
Okay. It's funny because, I always try to get 8 hours of sleep. It never really happens. Sometimes it's, closer to 7.5. But every once in a while, if I can't sleep very well, I might get like 4 to 5 hours of sleep. And I feel like I'm going to be so exhausted the next day, but for some reason it feels like I have this burst of energy, so it doesn't really make sense. So I don't know if you're just running on fumes.
No, and you may have actually slept. If you feel like you haven't slept and you wake up and you're like, I feel like I haven't slept all night, you actually may have gone into certain REM cycles.
Okay.
And even though you feel like you didn't sleep or you were having a lighter sleep, you actually may have slept.
Okay. Really interesting.
And that's what the sleep studies will tell us. We'll be able to see, if you're actually going into a deep sleep or if you're staying in a different sleep pattern throughout the night, which is important to see.
Are there parts of sleep where you can still sort of like hear what's going on or still sort of remember, and that's still considered a light sleep?
Yeah. Yep.
Okay. Very interesting. So you could still feel like you're awake but be sleeping.
Yep.
Okay.
It's weird.
Interesting but confusing.
Very.
Okay. All right. So let's talk about, any tips that you have on getting a good night's sleep.
Yeah. So one of the biggest things is actually establishing a sleep routine. It's helpful to keep a diary of, what you do throughout the week to get ready for bed. Do you have a consistent bedtime? Like, I find that if I'm in bed by 10 o'clock every night, my body kind of settles down. One of the things that you should do is have, when you're keeping this diary, is seeing if you do the same things every night, or if you go to bed at the same time every night and you're not like partying on the weekends till 2 a.m. because then your body is trying to always catch up on sleep if you're not following that sleep routine. Your body should also know that it's time for bed. So you should have in your house overall, like the lights start to dim, like as you go through the evening and into the later hours of the night, dim the lights in your rooms that you're using, shut the lights off in the rooms that you're not using. You don't want to have it be as bright as daylight in there until 10 o'clock at night and then you're ready to go to bed, because then your body can't focus and get ready for sleep.
Okay.
You should remove all TVs from your bedroom. I know that sounds crazy, but get them out of there. They're not good for a good night's sleep. A lot of phones and tablets now have a nighttime mode where you can put them in a black and white mode or change the color. That
it's
actually
called blue light, right?
Yeah,
I have one on my phone.
Change that, and it helps your eyes to like really get used to a darker light and your brain's not stimulated by a brighter light. You should also use like lightweight sheets in your bed, something that is cool. You want your room to be cool but not cold. Pajamas that are lightweight are very helpful, that are loose but not so loose that they're falling off of you, and you don't want them too tight either. It's kind of like Goldilocks in the three. It's also helpful to do meditation or reading before bed. And then once you start getting into this routine, your body will start to know that, okay, the lights are going down and now it's going to be time for this, having some water before bed. And then your body is calm enough where when it comes 10 o'clock, 11 o'clock at night, you're ready to settle down and it's easier to fall asleep. Some people love the smell of lavender. Lavender is very calming as well. They have great like lotions and sprays for your bed and your pillows.
I have a lavender pillow spray for my bed, actually.
Yeah.
I just always forget to use it, but I notice that when I use it, I'm like, ooh, that's really nice. It's supposed to relax
it doesn't. It definitely has like calming properties to help you relax and go to bed. So I definitely am a big fan of that myself.
Okay. What about like eating too late? Does that affect your sleep because it's giving you like energy?
It could give you energy. It could give you heartburn. And just depending on which way you're laying, that could upset your stomach, and then it can wake you up, and you would have an interrupted sleep pattern.
Okay. Well, that makes sense. Those are real good tips. I learned a few myself. Stop looking at my phone at night.
Yeah.
Don't eat too late, which is really hard to break. And use that lavender spray on my pillow. Okay. All right. So you mentioned that there are some, common sleep disorders that you diagnosed there. One was the narcolepsy. Did you say
obstructive sleep apnea? That's the biggest and most common disorder that we see at the lab.
And what exactly is that?
So obstructive sleep apnea happens, something's obstructing your airway at night, so it could cause snoring, it could cause you to stop breathing in your sleep, which then causes a whole other bout of issues. So we can treat that with CPAP or BiPAP. Oral appliances are super helpful. Sometimes they do surgery and they clear out the back of your throat, because sometimes you just have a lot of tissue back there.
Yeah.
So they can go in and clean it out, and that can help as well. So.
Okay. And does like weight gain also cause that?
Not always, but it can affect it. The size of your neck, too, definitely matters. People with larger necks tend to have more obstruction while they sleep.
Okay. Well, that sounds like there are so many different disorders and, things that could cause sleep disorders. So really need a specialist to check those out for you. So this has been really helpful information. I have more questions for you, Melissa, but so far we've learned about what the sleep lab is, the types of sleeping disorders that you can diagnose there, and what you do over there at the sleep lab in terms of, sleep studies and whatnot. So when we come back, we're about the halfway point of today's show, so it is time for us to take our second break of today's show. And I want to talk to Melissa a little bit more about snoring, a little bit more about, how folks can get in touch with you if they feel like they might have a sleep disorder and want to have a study done. So we hope our listeners are enjoying today's show. And before we break, just a reminder again how you can contact us. You can email us at any time at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. Maybe you were listening today and you wanted to follow up and you couldn't find the phone number. If you wanted the phone number to the sleep lab or more information, you can always shoot us an email and we'd be happy to send that over to you if you have any follow-up questions or feedback about today's show. If you want to give us a shout out and let Melissa know you enjoyed the show, I think she'd appreciate that as well. So we are going to take our second break, and we will come back with more with Melissa about sleep health. We'll be right back.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
From all of us at Morton Hospital, thank you to our community for voting for us in the 2021 Best of the Best Community Choice Awards. We're honored to have been voted Best Hospital, Best Audiologist, Best Hearing Aid Center, Best Physical Therapy, and Best Weight Loss Center in the Metro South region. Learn more about our services and quality achievements at mortonhospital.org and follow us on Facebook to stay up to date on what's happening at your award-winning community hospital.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to the second half of today's Morton in the Morning show. Thank you so much for listening today and joining us for this hour right here on WVBF, your hometown radio station. Today we have a great show for you. We are talking about sleep health and, how poor sleep can impact your health. We're talking about some common sleep disorders. And before we took a break, we were talking with Melissa, who was our guest today, about, snoring and other sleep disorders, or, snoring is obviously a side effect of certain sleep disorders. And, a question that I wanted to ask of you is, are there any quick fixes to snoring? Like, I know more often people will snore while they're laying on their back, but if you have, a husband or a significant other who may snore also while they're laying on their side, why is that happening?
So they could be obstructing their airway of some sort. So they could be really stuffy. So sometimes a humidifier in the room or a nasal spray would help.
Yep.
Especially if it's just in their nasal passages. But if you're noticing they're still snoring and they're on their belly or on their side, one of the things that could happen is if they're drinking some alcohol, they may snore a little bit more, and it's because their body is so relaxed from the drinking that they may have a little bit more less elasticity in their airways, so it might make them floppier.
That makes sense.
But they could always come in for a sleep study, and we can really diagnose what's going on with them.
And does positioning, or your pillows sometimes have something to do with it too?
So sometimes we want to keep you a little bit higher up in the bed. We may recommend you adding a pillow, and those are all things that we can do in the sleep lab for you. So we recommend if you do come in for a sleep study, you bring your own pillow, what you normally sleep with, so then we can replicate it at home. If you sleep in a chair, we can replicate that. We have nice big recliners for our patients if needed. So we are able to see what you're doing when you're at home. We don't put you in not an ideal environment. We give you an ideal environment as the night goes on. We may lift the head of your bed. We may ask you to add a pillow. And we may just see what you do, so then your doctor has a better idea of how to treat what's going on.
Okay. And is there a type of pillow that's really recommended? Should it be firm? Should it be
I think
really
it depends
puffy?
on really your body position. They make different pillows meant for side sleepers versus belly sleepers. So knowing your sleep positioning could help you buy a better pillow for you.
Okay. All right. Now, you talked a little bit about, treatment options and determining what's best. You mentioned CPAP and BiPAP. Can you further explain what those mean?
Yeah, so they're fun little machines that come with tubing and either a mask for your full face that goes over your nose and your mouth, or a nasal mask that just goes over your nose, which most people like and they're more comfortable. They provide a pressure to keep your airways open. And then this helps you breathe better at night. It decreases the snoring that most partners complain about. It also will help with your oxygenation at night because those airways are nice and open and they're not closing, so you're not going to drop your oxygen levels at night anymore. It'll keep you breathing and all things happy.
Okay, so those are things that have to be prescribed or provided to you because they're customized somehow to you.
Yep, the pressures are all customized to your needs.
Okay. Are there any other treatment options? Or are those the
primary ones?
Okay.
Yeah.
Okay. And then, so you talked a little bit about what happens during the sleep study. Like while the person's sleeping, what's actually going on, or how do you get them to be comfortable and get to sleep first? So because in a different environment, it might be a little.
Yeah, it definitely is harder. We have light blocking blinds. Each room has its own temperature control. We close the door. We can give you as many blankets as you need, as many pillows as you need to really get you comfortable in the bed. Mm-hmm. I know it's hard to sleep in a foreign place, especially at the sleep lab, because you're hooked up to wires and monitors, but most patients actually do fall asleep, and we're able to give them a diagnosis after the physician reads and looks at their sleep study.
Okay. So they're hooked up to all the stuff, and is somebody like actually watching,
yes,
the screens of what's happening?
We do. We have people, our polysomnography techs, they watch the screens the entire time that the study's running, so they're able to see if the patient is dropping their heart rate, if they stop breathing, if they're snoring, what their oxygen level's doing, if they're really restless in bed, if their legs are moving, if their arms are moving, if some people have seizures in the middle of the night. So we're able to see and monitor that the entire time that you're with us.
Would there ever be like a case where you'd have to wake someone up, like if their issue is so severe? Or?
So sometimes we've had to wake patients up and then just adjust them in the middle of the night if their sleep apnea is really bad.
Okay.
We may have to add a pillow. We may split them, what we call, and put them on a CPAP, but we would call the physician first and say, this is what's happening with your patient. What do you want us to do? This is what we think. What's your opinion on it?
Okay.
Yeah.
And then, so the at-home sleep study, who qualifies for that versus having to come in?
So it mainly depends on what your doctor is looking for. Okay. So, and insurance coverage. So they may start you with a home sleep study, and you would come into the lab, we'd set you up, we show you how it works, put it in a little bag, and we send you home with the machine and then a sleep diary, and then you put it on right before you go to bed. You turn it on, get set up, and this way you're more comfortable. You're in your own bed. It's less wires. Yep. And then you return it to us the next day along with that sleep diary, so we know how many times you got up in the middle of the night, if you had your dog jump in bed or something, fire alarm go off in the middle of the night. We're able to see what's going on, and then from there, if we can't get the best reading or the doctor wants to see a little bit more, then they'll have you come into the lab for a more in-depth study.
Okay. And then, oftentimes people might have, comorbidities, associated with bad sleep. So do you often have to refer people to other specialists, like if you feel like they need to follow up on some underlying issue?
So the doctors will, the reading doctor will suggest following up with different providers if necessary. If they think an oral appliance would be good for you, they may recommend you go see a dentist or an ENT specialist. It really just depends on what we see when we're looking at the patient. But we have referred out to different specialties. We can refer you out if you're having like bad night sleeps. We can refer you to like behavioral therapists to help you calm yourself and give you different techniques if there's really no sleep apnea or narcolepsy seen. So we have options of people we can refer you to even if you don't have obstructive sleep apnea or a different sleep disorder.
Okay. So if someone thinks that, maybe they have a sleep, an issue with sleep, or, they have that significant other that they feel might have some sort of a sleep disorder, so how do they get in touch with you? What does the referral process look like?
Yep. So what you would do is you would go to your primary care doctor, and your primary care doctor can write a referral to the sleep lab for either a home sleep study or an in-lab sleep study. They can also refer you for testing, but have a full sleep consult, and that would refer the patient to Dr. Bahati as well. They'd go and see someone in their office for a consult, and then from there they would come to the sleep lab and have the recommended testing done by the physician.
Okay. And if there are questions about like insurance coverage, things like that, could they just call the sleep center and you have somebody who would answer the phone and go over that with them?
Yes, absolutely.
Okay. And the phone number is
508-880-0713.
Okay, well, this has really been very helpful. Like I said, I learned a lot. I'm sure our listeners also learned a lot. Sounds like we have a really great resource over at the center. Anything else you want the community or anyone listening to know about the services offered?
No, just come visit us at the new Sleep Lab at 91 Washington Street. We are happy to be closer to the hospital and able to better service our community, which is nice.
Great. All right, and you can also find info about our sleep center on our website, mortonhospital.org, if you click there, and you can also find the phone number there as well. So we appreciate all this great information. Thank you so much, Melissa, and we'll look forward to having you on again.
Thank you.
All right, well, that wraps up the interview portion of today's show. I thoroughly enjoyed today's show myself. I hope you all did as well. I learned a lot. I learned some great tips about, maybe getting better sleep. I'm definitely going to check out that sleep calculator on the American Academy of Sleep Medicine website that Melissa referenced so that you can plug in your information and, your daily routine and get a better idea of how much sleep you should be receiving. Also learned some great tips about, getting better sleep, turning off that TV at night, turning off that phone, dimming the lights, maybe not eating so late so your stomach isn't irritated. She really shared some great information, and I think hopefully a lot of us can also take back some tips. Maybe if you have, like I mentioned earlier, that significant other that might be snoring, how you can keep that from happening, by getting them to sleep a certain way or using a better pillow or propping up their head right, or again, referring someone to get a sleep study. If you think that they really have a problem and they're not sleeping right, maybe they're tired, or maybe you're tired often and you're not feeling like you're getting great sleep, that resource is right here in Taunton, right across the street from our hospital in a brand new, beautiful suite in that Liberty Medical Building. Go ahead and give them a call, talk to your primary care provider to see if a sleep study would benefit you. Because as Melissa said, if you don't get great sleep, if you have a sleep disorder, it can really impact your overall health and well-being and cause other issues for you as well. So thank you again to Melissa. Again, the phone number over at our sleep center is 508-880-0713. Again, that's 508-880-0713. And you can certainly call the Sleep Lab just to learn more about them, or if you have questions about, insurance coverage or how the services work. But as Melissa said, usually you need to get a referral from your primary care provider. So again, if you or a loved one feels like they have some issues with sleep or a sleep disorder, then talk to your primary care provider who can give you the best information. It is time for our last break of today's Morton in the Morning show. So when we come back from our break, we just have a few hospital updates to share, including a couple of shout outs and some news on some upcoming events. So stay tuned if you want to hear the latest and greatest happening here at Morton Hospital. Another way that you can keep up with what's happening, outside of listening to our show, of course, is to check out our website, mortonhospital.org, or to follow us on Facebook. We actually have a really active Facebook page. Our page is facebook.com/Morton Hospital MA. We post a lot of information, about services, new doctors, events that we're having, a lot of pictures of our staff, so you can get an inside look of, what's happening day to day here at the hospital. So please follow us on Facebook, give us a like. We also have Twitter and LinkedIn pages if any of you out there use those. So we're ready for our last break, and when we come back, we'll share those updates with you. So stay tuned. We'll be right back after this short break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Morton Hospital's nationally accredited Center for Weight Control has grown with the addition of Dr. Deepthi De Silva, our new Director of Medical Weight Loss Management. Our center now offers high-quality medical and surgical weight loss options close to home, with medical weight loss appointments now available in Taunton and Middleborough. To learn if you qualify for weight loss surgery or medical weight loss and to schedule a consultation, call our Center for Weight Control at 508-301-2434.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to the final portion of today's Morton in the Morning show. We've had a great new show to you today. We hope you enjoyed it. We spoke with our special guest, Melissa, and we talked all about sleep health and, how getting good sleep can impact your well-being. We had a lot of great tips on how to get better sleep, what might be signs of sleep disorders. And if you missed it, we talked a lot about, the recommended sleep that you should get. And for most, it's between 7 and 8 hours of sleep. But there's a really cool tool that Melissa shared on the American Academy of Sleep Medicine website. It is a calculator that you can use to sort of plug in your daily routine, your activities, what time you usually go to bed and wake up, and that can help you determine, what number of hours of sleep might be best for you. So that's pretty cool. I'm going to check that out after this show, and we thank Melissa for sharing that. And again, our sleep center is accredited by the American Academy of Sleep Medicine. They just received that accreditation again earlier this year, so congratulations to our Sleep Lab team, and thanks again to Melissa for joining us and sharing such great information for today's show. So let's talk about some hospital updates. If you missed the beginning portion of our show, at the very beginning I shared some exciting news that Morton Hospital has once again received an A hospital safety grade from the Leapfrog Group, and that grade is updated twice a year. The Leapfrog Group looks at several safety standards, patient care standards for every hospital across the country, and assigns a letter grade. And we are so happy to have received our fourth consecutive grade A for patient safety. And that is a testament to our amazing staff, and we thank them so much. I also mentioned that the Best of the Best Community Choice Awards is back up and running, and that is for 2022. And you can nominate Morton Hospital in several different categories for the Metro South Region Awards. If you go to the Taunton Gazette website or the Brockton Enterprise website, they'll have that contest on those pages, and you can go in and write in Morton Hospital for the nomination period in the Best Hospital category and several other categories, and we hope you will do that. We would love to take home our Best Hospital Prize or top award that we took home in 2021, so that we can recognize the incredible work of all of our staff here at Morton Hospital, who we are so grateful for. Another shout out, one of our providers here at Morton Hospital, Dr. Patricia Andrade. She is a general surgeon and a breast surgeon here with our Morton surgical team over in the Thayer building at Morton Hospital. She just received a very special honor. She was invited to be the Grand Marshal for the 50th Annual Cape Verdean Recognition Parade. So that is actually happening in July. We want to congratulate Dr. Andrade. What a great honor. She represents the Cape Verdean community, and she's done a lot of work in that community, both in the Taunton and Fall River areas. What a special honor. We look forward to celebrating Dr. Andrade and watching her as a Grand Marshal of that parade in July. Also, another shout out to our Chief of Psychiatry, Dr. Leonardo Batista. So last week, Dr. Batista actually participated in an interview with Mayor Shauna O'Connell, and that was filmed by the folks over at TCAM, and that will be part of a series of videos that the mayor is sponsoring to highlight mental health awareness as well as mental health resources here in our community. So we were honored to be part of that. Dr. Batista talked a lot about, stigma associated with mental health and how really every one of us needs to or would benefit from seeing a mental health provider. And he talked about the resources that we have here at Morton Hospital, including our outpatient psychiatry clinic and our inpatient elder behavioral health services unit. So we really look forward to sharing that video. Again, they're being sponsored by Mayor Shauna O'Connell. They are going to be aired on TCAM, but the City of Taunton is also sharing the videos on their Facebook page. So that should be up on the City of Taunton page, as well as the Morton Hospital Facebook page. If not by the end of this week, then hopefully early next week. And there's a lot of great information. In addition to Morton Hospital, the mayor has also interviewed Erin at the YMCA's Family Resource Center, who also has a lot of great programs for families in our community related to mental health and wellness. So again, we will look forward to sharing that once that video is all ready to go. So let's talk about some events. So May was full of events for us here at Morton Hospital. In addition to Hospital Week and Nurses Week, we also celebrated EMS Week. And one of the special ways that we celebrate our local EMS providers during EMS Week is we have an annual EMS Stewards of the Community Awards event. So this was our fourth time doing these awards that have been put on by Steward over the past several years, and each hospital collects nominations for this award in their local community and selects one or two recipients to receive their award every year. And we were very, very honored to present Morton Hospital's award to Scott Meager. So Scott is the chief or chairman at Rehoboth Ambulance, and he is also the paramedic and EMT program director at Massasoit Community College. He was nominated for this award actually by his daughter, who was also an EMT. And really this award was all about recognizing Scott, sort of like a Lifetime Achievement Award for all of his contributions to EMS and to residents of our community in his many, many years of service. So we want to say congratulations to Scott. It was very well deserved, and we had a great night celebrating Scott and the other recipients at the EMS Stewards of the Community Awards for 2022. Some upcoming community events. There's a lot of great ones coming up. Next week, we will be at Manic Community Health Center's June Bloom fundraiser, and we are a sponsor of that event. And we always like to support our friends and partners over at Manic because, we have a lot of shared patients, and we support the patients in our community together for all their primary and preventative care needs. And they are doing that event at Lombardo's in Randolph. It is Thursday, June 9th from 6 to 9 p.m. So we really look forward to participating in that and helping to raise funds for Manic Community Health Center. Another exciting event coming up is the Rotary Club's annual Family Fun Day. That event is actually next Saturday, June 11th from 11 a.m. to 3 p.m. at Camp Riverside. The rain date, in case it does rain, is June 12th, but that's going to be a great family-friendly event. It's free. The admission is free. You can take your whole family to this event. They're going to have water slides, train rides, music, a splash pad, a magic show, pony rides, a bouncy house, and lots of other great activities, family-friendly activities. So, if you want to check that out, you can find more information on the Rotary Club of Taunton's website. But again, it's free, so you can just show up at any time. It's Saturday, June 11th, 11 a.m. to 3 p.m. at Camp Riverside. And Morton Hospital is also a sponsor of this great community event. So many great events coming up. It's that time of year where it's really busy with events, and we have certainly been very busy in terms of participating in events, but also sponsoring many different community events because we love to do that. We love to give back to our community. We love to support our community partners in any way that we can. So we also really love sending our staff. Our staff really enjoy participating in all of these great events. So we look forward to those coming up, and in our future shows, we'll keep sharing some news about these great events happening both here at the hospital and out in our community. So that pretty much wraps up today's show. Before we end, again, I will remind our listeners how you can contact us at Morton in the Morning. We choose topics for each show that we think a lot of people would have interest in, but we also want to hear from you. What do you want to hear about? Are there health and wellness topics? Are there doctors you'd like to hear from? Let us know. You can email us at mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. So that's our email address. It actually comes right to me, so I'll see it when it comes in. I'd be happy to respond to you if you have any of those suggestions for future shows or feedback about our shows, or if you just have any follow-up questions, maybe a point or a tidbit that you missed on one of our shows, or for contact information. I'd be happy to share that with you as well. So we want to thank you very much for listening. Again, thank you to Melissa for joining us today and providing such great information and putting on a really great show about sleep and the importance of sleep for good health. And again, thank you and congratulations to our entire staff here at Morton Hospital for helping us to earn our grade A for patient safety from the Leapfrog Group. So we hope you will continue to join us. Summer is coming and the warmer weather is here, but you can listen to us anywhere, whether you're driving in your car, if you're going to the beach, or if you're at work. Tune in and listen to us. We come to you every Wednesday at 11:05 a.m. right here on WVBF, your hometown radio station. And we'll look forward to joining you in the coming weeks with some more new shows and some new special guest interviews. So that wraps up our show today. Thank you again for listening. From all of us at Morton Hospital, we hope you have a happy and healthy week, and we look forward to speaking with you soon. From all of us at Morton Hospital, thank you to our community for voting for us in the 2021 Best of the Best Community Choice Awards. We're honored to have been voted Best Hospital, Best Audiologist, Best Hearing Aid Center, Best Physical Therapy, and Best Weight Loss Center in the Metro South region. Learn more about our services and quality achievements at mortonhospital.org and follow us on Facebook to stay up to date on what's happening at your award-winning community hospital.